established a connection. And welcome. Thank you for being tonight with us, Dr. Cheng. For all our viewers who perhaps doesn't know or just heard, Dr. Cheng is the head, the mind behind all the Rejuvi formulations. He is a developer of all the successful Rejuvi scar care, skin care, tattoo ink remover formulas. And he is here tonight with us to talk about the techniques and about the formulations that exist in Rejuvi line for scar care, for treating the scars, enhancing the scars. And we are really happy to have this possibility to meet you tonight, Dr. Cheng. Thank you very much again. Please, can you tell us just few words about why are the Rejuvi products so successful on the market? Why they are special? How are they special? How do they differ from other alternative products?
Thank you, everybody, to join our interview today. And I try to use my best information to provide to you. And Rejuvi Laboratory is a high-tech leading laboratory. We specialize in the research and development. And our philosophy is the synergism and use the multiple technique to solve the problem. For example, we use the biochemistry, we use the dermatological science, we use the cosmetic chemistry, we use the herbology. All those one combined together become a very powerful synergistic effect. So that's the difference from the most other philosophy. Other company, they use a single technology, like alpha hydroxy appeared in the market in the late 1980s. So everything is the alpha hydroxy acid, cleansing, moisturization, whatever, night cream, day cream, everything is the one thing. So we use the different stuff to combine together. That make a big difference. We call synergism. Synergism means 1 + 1 is more than 2. Yeah. So yeah, go ahead.
I understand that you are collecting the best technologies in a certain direction, and you are combining them in the sequence of product which are complementing each other in the highly technological and very convenient for a certain problem way.
Yes. So you asked me about scar reduction, tattoo removal. I give you some history. Tattoo removal technique was developed in early 1990. So right now, it's more than 25 years on the market. We're the first one, and that's more creative. Nobody had this technique before. So, and right now, this technique still is the leading technique in world market. And we have been very successful with many successful users, and the result is more than desirable. And for scar reduction, we developed this one in probably about 2008 or 2009. The reason we developed scar reduction is scar formation is one of the risks in the body tattoo removal. We see the problem, we want to overcome the problem, we develop a technique, try to reduce scar. That's our original motivation. So the scar is a very tough, intractable subject in the skin disorder or medical field. Right now on the market, you only see silicone gel, silicone cream, some kind of onion extract, the cream, whatever, and it's not very effective. You have used it for years to get a very little improvement. The laser and the IPL are expensive, but also have very limited effect as well. The only thing is the surgical excision. You mean use knife to cut it. But the point is very expensive. You get more than 60% chance for scar to recur, regeneration. That's a big problem too. So in other words, the scar reduction is really underserved on the market. That means there's no effective technique to reduce scar so far. So we use lactic acid, which is the alpha hydroxy acid. We use salicylic acid, which is the beta hydroxy acid. We also use 1,3-dihydroxybenzene. It's a special structure similar to salicylic acid. Also with allantoin and licorice extract, which is herbal. We combine them together, let them to penetrate the skin pretty deeply. Under those conditions, the scar tissue or collagen fiber somewhat get degradation, become soft, become mobilized, so that they can redistribute. They can make reorientation in the normal structure. So this is how scar can be reduced. So you can see you need a good formulation, you need deep penetration. You must achieve both two factors. Even the ingredient is effective. If you only apply on the surface, no deep penetration does not work well. So that's why you can see in our technique, you had to apply up to 15 coats, or use the dry needling or microneedling or microchanneling, and then you can reduce to maybe 6 to 7 coats. So you apply that one within half hour or 1 hour, then leave for 2 days, 48 hours. No contact with water. So
Okay.
this is called scar care formula.
So can we basically summarize all the before said is that Rejuvi scar care formulation is using alpha and beta hydroxylic acids in order in the application to this defectively structured collagen, and it is working to improve the collagen structure of the scar formation. Is it correct?
Yes. You know, scar formation usually is deep into the skin. If you scratch skin on the surface, you will not get a scar. Skin will become normal pretty soon. So scar usually due to the deep injury we call the endodermis, endomesodermis. And in the epidermis or apodermis, they're not called scar. So that's why we use a special formulation. You penetrate deep into skin under this condition. The collagen fiber or scar tissue is going to somewhat degradation. That means it somewhat becomes soft or decompose a little to some degree and become soft, to become mobilized. Then they are able to rearrange. We call redistribution. and you make unorderly arrangement to orderly arrangement. This is the scar reduction process. In addition, you also, they adjust level to surrounding skin level. That means it's high, go to low. If low, go to up. That means you can resolve the keloid or hypertrophic scar. Furthermore, we found out this condition, we also can normalize skin, the scar color. Usually this scar gets a dark brown color, which is different from skin color. And so in our finding observation, we think this formulation is able to normalize skin color. That means restore melanocyte, the cell produce melanin in the skin. So that's why you can see, and oftentimes, yeah, skin get normal color.
So actually, the scar care formula is not only dedicated to fixing the appearance of the scar as a structural appearance, it as well is working for the reviving of the melanocyte function, which is melanin production, in order to regain the normal pigmentation.
Yes.
Is it correct?
Yeah, this is a very important finding. Yeah, this is a very important finding. So far, depigmentation and hypopigmentation had no solution, because if skin gets white spots, nobody can do anything. But our method, formulation, seems to normalize the melanocyte. They can restore the original skin color. That's amazing new finding. And we probably will do further research to use this technique to overcome depigmentation or hypopigmentation, meaning white spots, in the future.
It's like a vitiligo condition.
Yes, yes. So, you know, basically you can see after surgical scar, after surgery, people get a surgical scar, usually it's white, no skin color.
Yes.
But in our practice, 15 years old, the knee surgery scar, from white go to normal. The color became almost same as the normal skin color. So that indicates the scar care formula
as well managing the color by reviving the melanocytes, those cells that are responsible for producing melanin, which actually gives our skin a color. This is absolutely amazing. This is very interesting. Can you tell me, is it possible for the scar care formula to be used as a home care, or is it better to provide this treatment by the technician who is specialized and specially trained in it?
Yeah, so scar care formula is a professional product, and it should be performed in a salon, spa, or clinic. And usually you can use the micropigmentation. No, you can do dry needling or microneedling, and usually for non-sensitive skin area. You had to avoid, be very careful for the breast or under neck area, which is pretty sensitive. And in this case, you may not use the dry needling or micro needling. But for other places in the muscle area, you can use it for sure, no problem. And so scar care formula usually performed with half hour to 1 hour to achieve 8 coats or 15 coats. Then after 2 days, no contact with water. Then after that, you must use scar aftercare kit, which is another very important, we call it indispensable portion of the scar reduction. Let me tell you why.
Can I just go back to what was just said? So basically, we can use a scar care formula not only on the scars that have developed due to performance of tattoo remover. We can as well use the formulation on the scars after the surgeries, including the breast augmentation, for example. But we have to be really careful when we are working in the breast area, especially around the nipple. But it is possible to work and to enhance, to make better the scars that many women have, like under their breast after the breast implant insertion. It is possible.
So basically, if you talk about scar prevention instead of scar reduction, is that your question?
Scar reduction after surgery.
Yeah, after surgery, usually the scar care formula treatment must be done after skin heal. That means no open wound, no bleeding, and not sensitive for touch, yet avoid those conditions. Then you can use the scar care formula. But however, so if skin still tender and not like normal, what you can use? You can use scar care gel and at the home care. After skin here, then you can use scar care formula at a professional treatment.
I see. So can I like make a conclusion of it? So basically, there is no particular time where we would say we can use the scar care formula after 1 month or after 2 months. It is very individual, and we have to see each person individually. How long will it take for the skin to stop being sensitive, to stop showing signs of the wound, to be completely healed, and only then we can start performing scar care formula as an application by dry needling or as an application by the brush in the clinic. But before we use the scar care formula, we can incredibly enhance and support the healing with the scar care kit, which can be used by the patient, by the person who has a scar. It can be used at home, yes, as a home treatment.
Yes, and the scar care gel was developed in 2009. And the scar care gel is a home care product, and it contains high concentration of the potassium iodide. This, in our 5-year practice, seemed to be very effective to make scar tissue soft and make collagen redistribution. So that's why this product is very good. Before we release the scar care formula, it was available on the market already. And with the great feedback, a lot micropigmentation artists or permanent maker artists, after tattoo removal, they use scar care gel as a preventive product because it makes skin softer, makes scar softer too. So this is one of the components in Rejuvi scar aftercare kit. But in addition to that, we have 2 more products in the kit. One is the conditioner oil. Conditioner oil contains omega-3, omega-6, which is called essential uh, fatty acid. The combination is very powerful for skin repair, in addition to skin nourishing, skin overcome dryness, because scar care formula contain acid, which is more aggressive. After that, skin need something for nourishing, overcome dryness. In addition to that, you need skin repair. That's why the condition formula can do a great job. Secondly, we add a retinol serum, which is the vitamin A complex in a high concentration. So vitamin A complex has skin normalization capability. Like a skin anti-cancer, the vitamin A complex can do a very good job for skin anti-skin cancer, because the skin cancer means the skin cell become abnormal, not regular. But vitamin A could normalize skin cell, become from abnormal to normal. So this is very important to help the scar rearrangement, redistribution, and for scar reduction. So that's why you can see we use 3 components in the aftercare kit. Use a different mechanism. You use every day, either 1 or 2 or 3. So you can see scar care formula only for 2 days. The rest of them we use every day. So added together, it's a very powerful situation for scar reduction. You cannot expect to do 1 treatment for 1 hour, that's it. Scar cannot be healed. You have to do the job every day. So that's why scar care formula must use it together with the scar aftercare kit. You must do it together. The scar aftercare kit could contribute up to 30% for scar reduction efficacy. So, which is very significant.
So basically, what we are saying is that we can alternate the treatments as after the surgery within 1 month or even earlier, depending on the healing process, the patient can start using scar care kit in order to promote and to help the healing process. As soon as the skin is well tolerant and well healed, we can start performing scar care formula at the clinic with the technician. And in between the sessions of application of scar care formula, we as well need to use the scar care kit. Is it correct?
Yes, that's an excellent idea. Actually, I want to make more clear. After surgery, before skin heal, you may use the scar aftercare kit, conditioner oil to help skin healing. Because omega-3, 6 combination is very good for skin repair. Also, you can retinol serum, and you can normalize skin cell. Also, you can use scar care gel inside. You can make a collagen redistribution to avoid abnormal arrangement, meaning scar formation. So I think it's an excellent idea right after surgery, and you can use the aftercare kit at the home care first. Once the skin become basically healed, everything become normal, then you can start using scar care formula as a professional treatment. This will be excellent idea.
Great. Dr. Cheng, we have here a question from Maral. She is asking if it is possible to use the scar care formula for enhancing the keloid scars. What is usually the routine about it? I guess definitely we would need a permission of the treating dermatologist or treating surgeon because as far as I know that keloid scars are recognized as a kind of abnormality. What would you suggest in this case?
Yeah. So Rejuvi scar reduction is mainly designed for the keloid, hypertrophic scar, and the surgical scar. So the difference between keloid and hypertrophic scar is if the scar go beyond the boundary of the injury. For example, you get injury in 1 square inch, then the scar stick out. It becomes hypertrophic scar. But if the hypertrophic area is more than 1 inch beyond the injury boundary, then become keloid, even bigger than the regular hypertrophic scar. So Rejuvi scar reduction is designed for the keloid hypertrophic scar, which is very tough, very difficult. So you can see in our most practice, people can see pretty good improvement only after 1 scar care formula treatment, usually around a month. You can see very good result. And you can do second time after 15 to 30 days, depending on skin healing. If skin is normal, you can do 15 days. Skin look still tending to touch, little not normal, and then you wait for a little longer time and still skin heal. Then you can do second treatment. You can do up to 4 or 5 professional treatment and to achieve the best result.
So basically, what I understand that we can help the patients with the keloid scars by applying the scar care formula onto the scars. And as you say, the technician has to be well trained and well qualified in order to recognize how long of a rehabilitation period does the patient need, because depending on the immunity of the skin, of the age of the patient, the healing process can go faster or slower. So it is up to the practicing technician to evaluate the healing process between the sessions of the scar care formula application, and decide whether we do the 2-week period break or a 1 month period break is needing. Is it correct?
Yeah, usually in the first recovery in the 15 days, about 2 weeks after scar care treatment. And some people take a little bit longer time, and for skin healing or recovery, probably take up to 1 month. I rarely see people take more than 1 month for skin recovery. So basically, from 15 to 30 days, then afterward, you can do second treatment if you want.
Okay.
And remember the aftercare kit will help skin healing.
Yes, here we have the question which I didn't really grasp. Can we use the scar gel with the retinol serum? Yes, I think that when we are doing a scar treatment, we have to use its after scar care product. Yes, definitely. That's what we were talking about, that when we are doing the scar care formula at the clinic, we definitely prescribe to our patient to to use the aftercare within how many days, Dr. Cheng, after the application. So we have applied the scar care formulation in the clinic, and we prevent this treated scar from contact with water for 48 hours. After that, how soon can we use the scar care kit or any of the products, which how do we start using the scar care kit after the scar care formula treatment? How
Okay, good. Yeah.
do we use it on the 3rd day?
Yeah, this is a good question. Some people, they feel a bit confused for scar aftercare kit because it contains three components, three products. So basically, after scar care formula treatment, waiting for 48 hours, no contact with water. After 48 hours or a little bit longer, then you can wash with soap and very thoroughly for the treated area. After dry, you use conditioner oil. The next day, you can use twice a day, in the morning and night, use the conditioner oil.
So
the next day,
with the conditioning oil, this is
yeah,
the first formulation to come in after the treatment. 48 hours, then we do a thorough wash. Do we apply any kind of scrubbing? Do we usually have the leftovers of the product, you know, all over the scar tissue, or we do not use any kind of scrubbing after 48 hours? We just wash
after
with
48 hours, yeah, after 48 hours, after dry, just apply conditioner oil on the treated oil, on the treated area, little bit over the farm, basically on the scar area only. And twice a day, in the morning, in the evening, then the next day, you switch to retinol serum. And twice a day, in the morning, in the evening. Then after that, switch back to conditioner oil again. So this process switch back and forth probably about 8 days, 8 days to 10 days.
So 8 to 10 days, we are alternating the day of use of the conditioning oil and the day of use of the retinol serum.
Retinol serum, yes.
But we
then
start
after
with the conditioning oil.
Yes, because those two products, number one, it helps skin healing, helps skin repair, makes skin softer. Then initial 10 days is very important. Then afterwards, we assume skin basically is okay. Then you switch to scar care gel every day, once a day or twice a day, either way. And until you can do second treatment. You see, it can be another 5 days or 10 days, whatever. Like if you take 25 days, 10 days for alternating conditioning oil and the retinol serum. 5 days for scar care gel, or 10 days for scar care gel, depending how long. And then afterwards, if skin is okay, you can do second treatment. But I think 80% to 90% people can see very good improvement after one treatment, after scar care, after kit as well. You can see very good improvement.
So basically, let me summarize. Basically, after the treatment, we alternate two products for 10 days, and then the scar care gel, we use the whole rest period of the rehabilitation until the next session. We keep using it for 5 or 10 days, depending on how long will it take for the patient to fully recover.
Yes, you are right. Yeah. So you can see, and the scar aftercare kit, keep working on the scar tissue, make them soft, make them somewhat mobilized to help redistribution of the scar tissue. So this is very important because you work every day.
We have a question here. One of the technicians is saying that one of your customers had experienced the redness after starting applying the retinol serum after having, so basically she had a procedure of scar formula, and then she followed the instruction. As soon as she started applying the serum, including retinol, she started to experience an irritation. Can it mean that she is having some kind of allergic reaction? What would you suggest to do in such case?
Yeah. So if you get redness, usually it could be caused by retinol serum, which is a high concentration, a little more aggressive than conditioner oil and the scar care gel. Then you can manipulate the frequency of the application for retinol serum. For example, you may use retinol serum less. You can use more conditioner oil, which can help skin healing better. So in the case of redness developed, you can reduce the application for retinol serum. You increase the application for conditioner oil, the problem should be gone.
So we could try then to use conditioning oil for the next 2 days, and then try to use the retinol serum once more and see how it goes. Instead of using it twice a day, then we would use, for example, 2 days of conditioning oil, and then 1 time per day the retinol serum. Yes, the technician has to offer the customer to alternate with the frequency of 2-day or 3-day period, correct?
Yes, yes. You see, because our instruction is more genetic, more mechanical, but a technician, they dealing with the customer, they need more information about skin healing, they can make an adjustment, because it's hard for us to make a universal procedure for everybody.
Absolutely. People, especially nowadays, many people are experiencing diverse allergic reactions to different products. So now even on bread and milk, we have the warnings about the possible allergic reaction. So basically, the technician has to manage with the customer and has to figure the way, to avoid the increase of any condition in case if any kind of irritation is seen on the spot. We have to reduce or absolutely stop using these particular products.
Yes, yes. So you can see even on the breast area, on the upper neck, no, lower neck area, you mean below the neck, those areas are very sensitive, delicate. But initially, you may not use any puncture, like a dry needling, micro needling. But later on, if everything is okay, you may use the same thing for scratching. Like Rejuvi has a long 52 needle, which is a bundle of 52 needles together in one rod. You may use the hand to make a right scratch on the scar area on the breast, so which is much gentler than the dry needling or micro needling. So you can further improve the scar reduction efficacy. So I think the technician need to practice, and they can get more experience. They know how to handle different situations. They can make this technique better, safer.
Absolutely, I agree with you. I agree with you. This is always the technician whose hand is on the customer, who can, first of all, as well, ask the correct questions, who can see if the patient has any previous known allergic reaction to any of ingredients. So those are all on the conscious of technicians to control and to prevent, actually, to collect the data from the customer in order to avoid a possible onset of any allergic reactions.
Yes, yes. So anyway, Rejuvi scar reduction provides the most effective cost-effective, simple, and relatively easy application. And so far, we have patent, we have no competition on the market. So just matter the technician can master this technique to serve people better. I think, we are successful in quite a few countries, including Tunisia, Spain, Greece, Mexico, where maybe 5 to 6 countries, we get a very successful positive result. I hope Lebanon will also get a very good result as well.
Yes, sure. We have a lot of technicians who are simply in love with your products, who are using them on the customers, who are as well eager to test the products and their actions on themselves. And we have very positive comments, and we are finding the Rejuvi Scar Care formula absolutely incredibly efficient on the hypertrophic scars. It is really acting like magic, and it is not only enhancing and prettifying the scar itself, but it as well, like you said, already after the first session, we are getting reports from our customers that even the tactile sensations differed, that in the places where the scar kind of pulled together the tissue, immediately after the first session, they already feel a relief. They feel no tension. So the collagen gets softened, and they are experiencing a physical relief from this scar, becoming more like a soft tissue, like a skin tissue. So it's not only the beauty matter, it's as well many times a matter of comfort, of movement, of having the freedom to not feel this tension in the scarred area.
Oh, thank you so much. Look like your petition already have been using the Rejuvi scar reduction technique with the positive result already. That's great. And I think you can do more training, let people understand the mechanism, and give the people more detailed procedure. And I think your video already, and we make a simple illustration video, and also you can make another video as well. And but the language is Russian, and you can understand, we can understand, And I think this technique can also be used by medical professionals as well. You may work with some dermatologist or doctor, and many doctors in America that are interested about this technique.
Yes, absolutely. I think this is very beneficial to let our practicing medical professionals, to let them know about this formulation and about other formulations. I hope that
maybe over the time limit already? It's too long?
Yes, we are somewhere on the time limit, and I would like to thank you. I would like to thank you for being with us tonight, and I'm sorry.
No problem, and thank you everybody to attend this live interview. Hopefully my information could help you, and I wish everybody had good luck with Rejuvi scar reduction technique, and stay safe and healthy.